Holly, can you hear me?
Georgia? What's wrong?
It's Max. He collapsed. He's not moving.
Does he have a pulse?
Okay. Yes.
Did you call 911?
They're coming, but the call dropped and I just didn't know what to do.
Put your cheek over his mouth. Do you feel air moving?
There's like a whistling, raspy sound.
Put the phone next to his throat. Georgia? Georgia, Max's throat is blocked.
What?
You need to make a new path so that he can breathe.
Okay.
You're going to cut a small hole in his throat.
What? Oh. No, I can't.
Yes, 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 you can, because I'm going to help you. Find something that can cut a hole in his throat and a tube to slide through it.
Okay. I have a pocket knife. Oh, God. And a plastic straw.
Use the knife to cut 3 inches. It doesn't have to be exact.
Okay.
Here we go, Georgia.
Oh, God.
Use your index finger.
Okay.
Find Max's Adam's apple.
Okay, I found it.
Feel down from there until you come to a little indentation. Make a 1/2 inch horizontal cut through that indentation.
What if it's not clean? What if I give him an infection?
Georgia, Max can't breathe. You need to help him breathe.
You can do this. Okay. I did it.
Good girl, good girl. Now, pinch the far edges together. Use your finger to keep the hole open and slide the tube halfway in. Air should be coming out of that tube.
It's not working. It's not working. It didn't work. It didn't work.
You might just need to help his lungs expand. Blow into the tube.
Come on. Come on. Come on. Come on. Come on. Oh, he's breathing. He's breathing. Oh, no. Oh, God. Oh, God. Hey, clear a path.
Those 2 sats dropping.
Okay, let's up oxygen 100%.
Push more fluid.
Does anybody know how long he was out for?
Everybody, out of my ED now.
Can we put him in Fowler? Step it out.
Should I page Dr. Candelaria?
No. Yes, yeah. Page her, please.
On 3. 1, 2, 3.
Monitor for ischemic cascade. Monitoring. Keeping compression. Increase it up.
Dr. Candelario is suctioning Max's lungs.
Let's open that.
He's really lucky you were there.
Stand by.
Hey, you want to step outside, get some fresh air?
What's the difference between 6 and 7 minutes?
6 and 7 minutes.
The EMT said he might have hypoxia. I don't know how to pray. I'm not religious, but I wish I knew how to pray.
Got blood.
What's happening? What's happening?
Could be ARDS.
Oh, God. What is that? Did I hurt him?
No. I think you might
might have just saved his life. It's called a paraneoplastic syndrome.
The way his skin got red and swollen where you kissed him, that's happening everywhere in his body. Everything's becoming red and swollen and shutting down.
From the cancer?
Yes. But now that we know what it is, we can treat it.
And he'll be okay, right?
We'll have to wait and see.
Should have told everybody from the beginning. I've been wrong before. Sure. I want to start chemo. No clinical trials, no risk. I don't want to risk losing you again.
Bertha James, 64 years old, accidental impalement on pruning shears, BP 138/74 and slightly tachy at 114. Already vaccinated for COVID. Okay, let's get up day 24.
Let's get these things out of me!
We will, but first you need a CAT scan and workup so we can figure out the safest way to remove them, okay? How bad is the pain?
Bad.
Okay, Tehran, can I get, what's the... Is everybody okay? You okay? Is everybody okay? We need help over here! Let's pull him out. Let's get him out of here. Okay. Get maintenance down here now.
Are you kidding me?
Feel the excitement.
Excitement!
Okay, let's get him out of here.
DeMarcus Lot, 27, taxi to bike head-on collision. Whoa, what the hell happened here?
Emergency bowel disimpaction of the building's old drainage pipes.
Crap.
Well, let's hope not. Mr. Lott, how are you feeling?
Like I'm about to be internet famous. Check this out. Bounced off the hood of the car, rebounded onto the mailbox, landed smack on the pavement. That's why I wear a GoPro.
And the helmet. Brunstetter, let's order a CT scan for Mr. Lott.
Any more openings at Mount Zion?
I heard that.
Dr. Bloom?
Damn it, she's the Kipnick. Okay, let's get her on nasal cannula O2.
You think it was the shears?
They're nowhere near her heart or her lungs.
Hello? Somebody? It's just on my leg. You see this?
I got that on my arm.
We need to evacuate the ED.
Evacuate? Why?
It's not dirty water. It's a chemical spill.
Okay, the sickest patients and those with the most chemical exposure go to the front of the line for decon showers, chest CTs, and arterial blood gases. Les and Kate are gonna have to wait. Mrs. Westbrook, how are you feeling?
Better. Blood sugar's down to 187.
Okay, that's what I like to hear. Low exposure, back of the line.
Dr. Blue, I ran the symptoms by poison control, and they suspect an herbicide called 4-methyl-2-chlorophenoxyacetic acid. Apparently, MFCA is odorless, colorless, and highly corrosive.
What a great trio.
Coming through. I put the ED on diversion and activated hazmat protocol.
Hazmat?
busted pipe doused Bertha pretty bad.
Into the open wound?
Direct hit.
Since then, she's been tacky with runs of Y-complex VTAC.
Not to mention, this garden shear is still sticking out of me.
We're gonna get to those, but first we gotta take care of your heart and lungs, which means a decon shower to get the chemicals off your skin, and then some wound irrigation to get the rest of it out of your insides, all right? Just try to breathe.
Bertha's in, but we only have 2 showers. It's gonna take hours to get everyone through.
Okay, Hazmat's bringing more tents with more showers. Until then, we just need to hold on.
I'm gonna go find where an herbicide van in the 70s is hiding in our hospital.
Max? Max? Oh. Max, you need to get out of there.
I can't. If I let go of this, the whole tank's gonna give. It'll go all over the hospital. Hundreds of people are gonna be exposed. You need to go get help.
No. You're gonna leave. I'm gonna hold the pipe, and you're gonna go and get help.
I can't.
Why not?
I can't see. Ellen?
Hang on, Max.
You need to go.
Not without you. And if you're not willing to let go of that pipe, then I've got to seal the drain.
Helen, just go, please.
I won't. So stop yelling at me.
What are you doing?
Weighing down the trash lid over the drain. It's working.
It's working?
Give me your hand.
Are you sure?
Give me your hand. Watch your step. Hang on, Max. Okay, we're almost at the tent. Just hang on, okay? Help! Can someone help, please? Help! Oh, Floyd, he's drenched in MFCA. How are we treating acute exposure?
Tried everything.
And?
There's no treatment. Nothing's worked.
You good?
Wait! Where'd they go? I lost it! Where'd they go?
Whitaker's in back.
You okay?
I'm fine.
You sure?
Where'd they go? I can't.
God.
Whoa. Go.
Help! We need a stretcher over
I'll take Harry. Go. We got the patient.
Whitaker's down! Just keep breathing, Sam. Come on.
Whitaker, you with us? Yeah, I'm good. Where are we? Respiration's rapid and shallow.
Okay, let's set her up for a full trauma eval.
We're gonna take good care of you, okay?
I'm okay.
No, you're not. You need a head CT and you need that lax
I want to stay with Karen.
Go.
Pedestrian struck by ambulance. Lower body injury. Vital signs stable.
Okay, let's get her to Bay 23.
Carrie, what happened? We were driving crazy fast. Another car was coming out.
Transport patient from the ambulance, crash, severe laceration.
Get him to trauma 1.
What the hell happened right there?
Another car cut them off.
Carrie, we're gonna take care of you, okay?
Hey, is that bitch?
Trauma 1. Can you?
Yeah.
Rob, go get your head CT. Go.
Forceps.
You good?
Give us a little room.
Yeah. Can you see?
Yeah, there we go. We're clear. Staunch the laceration.
Tacky 144, 96 over 51.
Wait, look at this.
The bleeder's not our only problem, suture. This puncture happened in the crash, but we need to know what put him in the ambulance in the first place.
Whatever it was, must have been bad. Moreland was tearing down that road.
Respiratory rate's 13.
Can you ask him?
No, Moreland's in CT and Whitaker's in surgery.
Dispatch report.
On it.
I got around the car. It was me. I was going too fast. This was all me.
We did all we could. He's gone.
He's waiting to talk to the police.
Well, he's gonna talk to me first.
Max, you understand this isn't his fault, right? He's one of us. Max.
Where's the dispatch report, Rob?
It should be in the ambulance?
Yeah, should be, but it isn't because someone tore it out.
Okay, look, anything you want from the report, you can get from 911 dispatch.
I just called 911 dispatch, and the patient that he picked up, Mr. Santangelo, who is now dead, didn't call 911. He called the non-emergency line because he had a fever and his wife was concerned. The man didn't even need an ambulance. That's why you took this report, isn't it? You were driving like a madman with a non-emergent patient whom you knew had no business being in your vehicle. Keep it, or give it to the cops. I'm sure they'll want to read it.
Even if he was driving recklessly, there's no way they're gonna hang him. When a cop goes down, who's the first on the scene? Paramedics. The blue line covers them too.
No, he shouldn't need cover. He's never done anything like this before.
That may be true, but he killed a dude with a runny nose, Laura. And he almost killed his partner.
Whose side are you on?
There are no sides. It's just what happened.
Well, I want to know why it happened.
So, what's the emergency?
Mr. Santangelo lived on the Upper East Side.
What were you doing 40 blocks outside the hospital jurisdiction? Is that why you were driving so fast, just to make up the miles?
This is me now, Rob. Not the police. And you need to tell me why this happened.
We were ordered to make the pickup.
What? Ordered by who?
Our battalion chief.
Why? Why were you driving 1,000 miles an hour for a man with a fever?
Hey, look. We were told to ignore jurisdiction. Grab any patient we could anywhere in the city, then drive bat out of hell to make the drop so we can get back out onto the street as soon as possible.
That's insane. Why would he tell you to do that?
Private ambulance companies are killing us, Lauren. This is how you compete.
Your chief? He's done.
Wasn't his idea.
Oh, yeah? Then whose was it?
Dr. Fuentes, your new medical director.
Hey, help! I found it on the floor. It's shallow breathing, weak pulse, and
Max.
Hey, easy. Easy, Tiger.
Oh, it hurts. Everywhere. What happened?
We found Thanatifol in your blood. Happened last night at the bar.
My drink was spiked.
Not just yours, it happened to Wilder, Trevor, Mia, Casey.
Oh my God.
We're getting the word out to everybody, but right now you're my priority, which means getting you fluids and rest.
Oh, I'd rest a lot easier if my leg wasn't killing me.
Which one?
Left one. bad.
We got more of her labs back. Her D-dimer is high.
So is your protein. You're at 12 grams per deciliter.
What's my platelet count?
You're down to 25,000.
I am ripe for severe DIC.
You can have clots everywhere. You need a body scan now. Walsh, let's move.
Oh.
Doing great, babe. You're almost done.
How's it look? Max? Max, what do you see? Please, just tell me.
You have multiple clots in multiple arteries.
Where are they?
Renal and hepatic
2 surgeries? That's not too bad.
and gastric and ovarian and uterine.
So that's 3 more, including a hysterectomy.
Yeah.
I'm not having a hysterectomy.
Your uterus could rupture.
Yes, I know. I know that the clots are a problem and that I have to do something about them, but I want to try something less invasive. I want to try and break them up, so can you put me on a regimen of Platacel?
Platacel could lead to uncontrollable bleeding.
As a hematologist, I'm aware of the risk.
Yeah, and this seems like an unnecessary one. And surgery would mitigate a lot of these issues.
Yeah, and it will permanently change my body in dozens of ways.
I'm on your side. I'm on your side.
A hysterectomy. That's gonna permanently change my future. It's gonna change my personality. And I can't help but think of the fact that hysterectomies, they've been overperformed for decades on people who look like me. So if we're talking about risks, well, that's feeling pretty risky to me, and none of that is going to be mitigated. So.
I hear you. I do. But we're talking about your case. Your body had an extreme reaction to the thanatafol, and you want to add Platacel, which is long-acting. And if it doesn't work, then we're going to have to rush you into an even riskier surgery. I don't want to do that.
Please don't be my doctor. Be my partner.
So I just spoke to Dr. Malvo, who told me that the clot busting is working.
Yeah.
Yeah, you don't seem elated.
It's just this isn't quite how I imagined our first ultrasound as a couple.
Yeah. Totally thought it'd be your gallbladder.
Look, I know that we haven't discussed this, and I don't mean to just spring it on you.
I want to have a baby with you.
I mean, who even knows if it's possible? Frozen eggs, your cancer,
Let's not go there right now. Let's just live in the possibility.
Luna would love it.
Big sister? You kidding?
And we already have like 1 million baby clothes.
Yeah, in the crib, got that.
Baby practically pays for itself.
Yeah, and this baby would be a little mini you, so, you know, freaking adorable. had a whole plan. I had a whole plan to propose to you.
Excuse me?
Mm-hmm. These reservations at this fancy restaurant. I walked through New York City in the moonlight and everything. You know, I even got a ring.
Max?
But screw it. Maybe this place is as good as any. Will you make me the happiest man in this whole ICU? Will you marry me?
Yes! 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 Oh my God. Wait, you got a ring?
Yeah, I got a ring. I got a ring. It's nice. Should I get it? I should
Yeah.
get it. Okay.
Yeah.
Yeah. Okay, I'm gonna get it. I'm getting the ring. Yeah.
Give me a tidal volume 700, respiratory rate 12,
Then what happened?
and 5 PEP. One of the clots broke free and is lodged in her lung. We need to do an embolectomy now or she's going to die. Advancing the embolectomy catheter through the subclavian artery. Headed for the right atrium.
Oxygenation's falling. You gotta get the clot out of her lungs.
And smoothly through the tricuspid valve.
Okay, careful. You're touching the wall, the right ventricle.
I'm pulling back.
No, push through. The only way to get to that clot is to push through the heart.
If I advance any further, she could have a cardiac arrest.
If you don't get that clot out, she's not gonna make it. If her heart stops, I'll restart it.
You only have a few seconds.
I know, I'm ready. I'm not gonna lose her.
Advancing catheter.
It's all right. Just a few regular beats. You got it.
Made it. I'm at the clot. Activating embolectomy. Okay, got it.
Oxygenation is stabilizing. That's great, Lynn.
Well, now comes the hard part. The catheter's got to go out the way it came. You ready?
Yeah.
Out of the lung, approaching the heart, and through the pulmonic valve.
Defib arrest.
Normal pulse, good rhythm.
And the catheter?
It's out.
I was close.
She made it. She's gonna be okay.
Thank you, Lynn.